And we go back to our slide about abbreviations and let us make it full screen. Here it is. And well, so
Can I, ma'am?
Your name is
Nishat, ma'am.
Nishat. Okay, Nishat, please.
Yes.
So will you read
Yes,
about the
ma'am.
frequency of drugs?
Okay, ma'am.
This line.
The frequency of drugs, ma'am. Ma'am, on start with every night, and BD twice a day, and TDS is at thrice a day,
3
and
times.
QDS is 4 times. Yes, 4 times a day, and ma'am, 4 to 6 hours. Ma'am, every 4 to 6 hours we should take the medication.
Okay.
8 hour every 8 hour, and 1 to 4 hour, like every 1 to 4 hour we should take the medication.
Yes, every 4 hours. Okay, thank
Yes.
you. Well done. Yes, you're
Thank
right.
you.
Ma'am, can I?
Yes.
Can I, ma'am?
Yes, Rafael,
Ma'am.
please. Rafael.
Yes, ma'am. The routes of administration: IV is intravenous, ma'am. IM is intramuscular, ma'am. And SC is subcutaneous, ma'am.
Okay.
PR is per rectum, ma'am. INH is by inhalation or nasal or oral inhalation, ma'am. And NEB is by nebulizer.
By nebulizer. Okay, perfect. Well done. Thank you. And Ayman, please.
Can I?
Ayman.
Yes, ma'am. Ma'am, the next one is measurements. So ma'am, a microgram is, ma'am, first is microgram, and second is mg, that is milligrams, and third is ml, that is milliliters, ma'am.
Okay, great. So, so we understand these abbreviations, and it will be useful in the next. Let us practice just like reading these abbreviations and other ones. The task is to say the abbreviations as complete words. Here's the table, and there is an example which just illustrates the first line here. We have several columns here, the names of drugs, then dose, frequency of then route of administration, and so we have maximum per day, maximum dose per day. And the first line is about paracetamol, and it's given in the example. The doctor says, give the patient 1 gram of paracetamol, 1 gram, 4 times a day by mouth, up to a maximum of 4 grams. Do you see? We can also use give between and give up to a maximum of, like it's given here in the first sentence. Well, let us listen to Arun Chalam.
Yes, ma'am.
Arun Chalam, please.
Yes, ma'am. Vocabulary abbreviations, say the abbreviations as complete words. Ma'am, for the example, paracetamol, it is 1 gram. It should be taken 4 times a day and by mouth of 4 grams, ma'am. And second is neopyramide, ma'am. It should be taken 4 milligrams a day, a dose. And frequency is as needed, ma'am, as the patient requirement, ma'am. Based on the patient, that is pro-re nata, ma'am. Based on the patient's requirement, he can take, and he can be taken by mouth and 16 milligrams a day orally, ma'am.
Okay, thank you. So let's listen to who is speaking? Your name?
Nishat, ma'am.
Nishat, please.
Nishat. Yes, ma'am. Ranitidine, ma'am. 150 milligram, and it should be taken twice a day, and by mouth, and 300 300 milligram per day, ma'am.
Maximum. Okay.
Yes.
So let's listen to Madhumita now, please.
Yes, ma'am. Atorvastatin, it is 10 mg per day, 10 mg, ma'am, and it is taken 80 grams to the maximum per day, ma'am. It is taken orally.
And how often should we take it? I missed. OD, what does it stand for?
OD stands for
Who remembers?
Can I,
Can
ma'am?
I?
Ma'am,
Yes,
can
ma'am.
I?
Can I, ma'am?
Can I?
Can I, ma'am?
Ma'am,
Can
can I?
I?
Yes, please. Somebody.
Ma'am,
Ma'am,
OD
OD
is for daily.
means per day.
OD is for once a
Once
day.
a day, ma'am.
Once a day.
Once a day,
Okay,
ma'am.
exactly.
Yes,
Once a
ma'am.
day. Okay.
Daily once a day.
Yes.
a day by 24
Sorry.
24 hour, or ma'am, 24 hour.
Mhm.
Once a day or 24 hour.
Yes, you're right. Okay. Well, and well, let's move on. And here we can see our chart. And actually, we're going to listen to a doctor checking the chart with a colleague. But before we do this, let us just try to complete the chart ourselves. So we can see here different subheadings here. For example, here in the first line, we can see, so the heading says patient. And we can see the name of the patient. This is Mrs. T. Hawthorne. Then the next heading is DOB. What does it mean?
Date of birth.
Date of birth.
Date of birth.
Date of birth.
Okay, so drug. What should it mean here in this chart? Drug. What should be used?
The drug which
A
was
medicine.
prescribed by the doctor.
Medicine, ma'am.
Yes, medicine.
Name of the drug, ma'am.
Yes.
prescribed by the doctor. Yes, date. What should we write here?
Date of prescription, ma'am.
The date.
Exactly.
Which date
Date
ma'am.
of
prescribe
prescription.
this drug, ma'am?
Then there is route. What is
How
it?
it should be
Of
taken.
administration,
means
ma'am.
of
How
How
it should be taken.
intake.
Yes, we have
Mouth,
information.
oral.
Yes, those we see. Start and time.
dosage. When should we start
When-
like taking the
Yes.
medication?
At a time,
And at
like
what
ma'am,
time?
day
or
or
When
night
should we
night.
it
start
means?
and what time?
The time of
Day or night. Yes.
just, the patient starts taking the drugs. Max frequency. What does it mean?
Maximum amount of dosage that
Maximum.
can.
No,
Yes.
how
Yes.
much?
Amount of doses taken in a
Amount
day.
of drug.
Then maximum dose and dose taken each time.
Per
So
dose.
here, yes, indication for use. So
How
How
to
to use
take
those medicines, ma'am,
Yes,
to
ma'am.
take it.
yes, the route of administration.
Route.
Route is for administration. How to take.
Okay. Then there is given by. What should we write here?
by doctor which like
Doctor's name,
name.
ma'am.
Doctor's name. Yes. Okay, and the signature, as you see. Now we are going to listen to a doctor checking the chart with a colleague, and we should complete the missing information in the chart, just as it said in this conversation. Okay. So you should make notes, and you should tell me if you're here or not.
Unit 5, Listening 1.
Can you hear?
yes ma'am. Yes ma'am.
Yes, ma'am.
Yes, ma'am.
Now
Yes, ma'am.
let's start.
Unit 5, Listening 1.
Let's see now. Mrs. T. Hawthorne, date of birth 4th February 1963, hospital number 1834572Z. She was prescribed tramadol today, 15th October 2009, given intramuscularly 50 milligrams, started on 13th of October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. to be administered as required intramuscularly and given by senior nurse Bond.
So, did you write? Or do we need to listen for the second time?
Yes, ma'am.
Yes, ma'am.
Okay.
Just
So one more
ma'am.
time now.
Unit 5. Listening 1.
Let's see now. Mrs. T. Hawthorne, date of birth 4th February 1963, hospital number 1834572Z. She was prescribed tramadol today, 15th October 2009, given intramuscularly 50 milligrams, started on 13th October at 11:30. All okay. Maximum frequency every 4 hours, maximum dose 600 milligrams. Okay. To be administered as required intramuscularly and given by senior nurse Bond.
Okay, who will read this chart? Who will
Can I, ma'am?
repeat?
can I?
Can I, ma'am?
Your
Can I?
names?
Ma'am, can I?
Vandana.
Can I, ma'am?
Can I?
Who, ma'am?
Can I, ma'am?
Okay, let us listen to Rafe.
Yes, ma'am. Ma'am, the drug is tramadol, ma'am. The date is 15th October 2009, ma'am. The route is intramuscular, ma'am. And the starting date is 13th October and time is 11:30, ma'am.
Okay.
And maximum frequency is every 4 hours, ma'am. Then indication for use, ma'am, as required, and route is intramuscular.
And given by
By senior nurse.
senior nurse.
Yes,
Senior
nurse
nurse
Martha.
Bond.
His name is
Bond.
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 Right. Okay.
What is the
Yes,
bond?
ma'am. Bond.
Yes, you're right.
Yes.
Perfect. Well done. Yes, good. And
Unit 5.
so now let us read some information about this woman here in the picture. Her name is Joyce Kame, and so she's just telling us about her job. It's my job. This is the name of the story. Now let's read the article, what she says about herself, about her job, and then we'll try to answer some questions. So I've divided the text into several paragraphs here, into several slides. Let us listen to Aymen now. Start reading, please.
Yes, ma'am. Reading, it's my job. I work as a nurse practitioner, NP, at New York City Hospital. I am a registered nurse who has completed specific advanced nursing education. I have a master's in cardiovascular medicine and training in the diagnosis and management of common medical conditions in this specialty.
Okay. And the next one is for Aron Chalam, please.
Yes, ma'am. Ma'am, it's my job reading. I provide much of same basic non-emergency care provided by physicians, generally of the type seen in specific practice areas like family practice offices, urgent care centers, and rural health clinics, and maintain collaborative working relationships with physicians. As an NP, I am licensed by the state in which I practiced through the NCC, National Certified Corporation, for specifically practice. Rather than a generic focus of education, as a nurse practitioner, I am able to specialize in an area of study I desire and provide care within the scope of my expertise.
And one more time, what do these letters stand for? NP.
Nurse practitioner, ma'am.
Practitioner.
Okay. Yes.
Practitioner.
Okay. The next piece of information is for Madhumita.
I may treat both acute and chronic conditions as well as prescribe medications and therapies for the patient at hand. The core philosophy of the field is individualized care. Nurse practitioners focus on patients' conditions as well as the effects of illness on the lives of patients and their families. Informing patients about their health care and encouraging them to participate in decisions are central to the care provided by NPs.
Okay. And this one is for Divya.
Yes, ma'am. Reading, it's my job. A major concern for myself and other medical practitioners at all levels is concordance. Once a drug has been prescribed, concordance involves a process of prescribing and medicine taking. It is a kind of partnership. It is not just a matter of explaining the benefits of prescribed drugs and the side effects, which can sometimes happen but which may not. Improving concordance is about involving the patient in making decisions about the treatment.
Thank you. So, and here we have definition of concordance. This is a process whereby the doctor and the patient cooperate in the prescribing process to maximize the taking of medication. So this is a kind of agreement. Well, and so if we move to the next slide, we can see the questions just to the article we've just read. Let us try to answer the questions, find the answers, and let's listen to Priya. The first question is for you.
Yes, ma'am. Is a concordance a cause of concern for nurse Crane and her fellow NPs?
Can you answer the question, Priya?
Yes, ma'am.
So this is just the question that you should agree or disagree. Is it the cause of concern, the concordance? Yes, no?
No, ma'am.
So if we speak about concordance, so I mean in this part of the text.
Ma'am, it's a matter of concern for her and medical
Major
practitioners.
concern for them, yes.
Yes, ma'am.
About this. So, okay, the next is for Prerna, please.
Yes, ma'am. What type of conditions can she treat? As a nurse, a practitioner, she said that she does some non-emergency care, which was provided by some physician, and also she said that she has some, according to her study, she care within the scope of her expertise and all. So basically, she works under some physicians.
Okay.
The work provided by them.
Ma'am,
Okay.
she can cure both acute and chronic conditions.
And chronic conditions, okay.
Yes, ma'am.
As well as she can prescribe some medications.
Really?
And
Okay.
therapies to the patient.
So then let's listen to Nishat for the next question.
Yes, ma'am. What does she consider the central philosophy of working as a national practitioner? Ma'am, she contact with the patients and give them medication prescribed by the doctors. As well, she treats in emergency, both chronic and acute, diseases, and in situations of emergency, she helps the doctor, and
Okay.
outdoor also.
So the core philosophy here in this paragraph, what does she say about the philosophy?
Yeah, she treats both acute and chronic condition as well, and is individualized care, ma'am. She gives
Individualized
individual
care,
attention.
yes, this is just the core philosophy. Okay, so let's listen to Nishat. Yes.
I just know, ma'am.
No. So Prakriti, yeah.
Yes, ma'am.
Yes, ma'am.
Ma'am, why does she feel her patient need to be involved in treatment decisions? Ma'am, informing the patient, encouraging them to the participate in the decision are central to the care provided by the UP. Like,
So,
ma'am,
to improve something. So they should take part in the making decisions.
so, ma'am, healthcare encouraging
To improve the
Also, so they can
concordance, ma'am.
the contribution of the patient so that they can complete cooperatively cooperate payment.
Also,
Basically to encourage the patient, ma'am.
Yes,
Encourage
ma'am,
the
encouraging
patient
the patient.
to improve
Yes, ma'am.
concordance, the
Yes,
cooperation.
ma'am.
with
To
the
improve
patient.
concordance.
Okay.
Yes.
So the next one is for Samhita, please.
yes, ma'am. What specific post-graduation training has she undergone? Ma'am, the nurse practitioner has completed specific advanced nursing education, and she holds a master's degree in cardiovascular medicine.
Okay, yes. I'm glad you remember this. And now, Rafael. The last
Yes, ma'am.
question.
How does her work compare with that of physicians?
Yes.
Ma'am, basically she provides some basic non-emergency care, ma'am, and she practices the areas like family practice offices, ma'am, and even urgent care centers, ma'am.
Okay.
In the rural health clinics, ma'am.
Okay, good.
And she maintains a collaborative work, ma'am, with the
Collaborative work,
physicians.
ma'am.
Yes.
I see.
Collaborative work relationship.
Yes,
With the physician.
which is very important. Okay, so these
Yes.
are responsibilities of a nurse, and let us just think about two more questions here. Who do you think should have the right to prescribe medicine? So let us listen to Aymen. What do you think of it?
Yes, ma'am. Ma'am, here, as I know, ma'am, the PG doctors, postgraduate doctors, has best right to prescribe the medicine, ma'am.
What about
And,
nurses?
More, ma'am, they are actually trained in like training or therapies. So I don't think they might have right for prescribing the medicine, ma'am, because they are trained for some like they are trained for some courses, but not like in particularly in medicine, ma'am.
Yes, they provide some practical
Ma'am,
help to the patients.
Yes,
Yes.
ma'am.
In treatment, during treatment.
Okay.
Yes, ma'am.
And if we think about other types of just doctors, for example, dentists.
Yes, ma'am.
Can they
They
prescribe any
also,
medicine?
Yes,
yes,
ma'am, they
ma'am,
can
they
prescribe.
can.
Yes, ma'am.
yes, ma'am. A dentist can prescribe, ma'am.
Okay. Okay, and the next question. Do you have nurse practitioners, nurses with similar roles in your country? So who can answer this question?
Yes, ma'am, we can see that here we have some nurse practitioners who have similar roles.
Yes,
And
ma'am.
in one of our discussions, I said that nurses and nurse practitioners, they take care of the patients, and doctors, the superior doctors supervise them. They take rounds on periodical basis. So all the time the nurse is there. So this is I guess, the similar role.
Okay, good. So, and if we move further, so here is the conversation about benefits and side effects of medication. Now we can see that we're going to listen to Dr. who explains the benefits and side effects of aspirin to a patient, Mr. Johnson, who is being discharged after the uncomplicated MI. So MI stands here for
Myocardial infarction.
infarction, which
Yes,
is
ma'am.
the same as
Myocardial
heart,
infarction, ma'am.
yes, heart attack.
Heart attack.
Not just a technical term. And discharge, as you see, this is tell someone that they can leave a hospital now. And here are some sentences from the conversation, and we should think how to complete the gaps, the blank spaces here in each statement with your own words. So just I will take I will give 5 minutes to you just to think about, to read the sentences and to think what is missing here, what can we write in the gaps here in each sentence. So please make notes, do it individually, just in 5 minutes. Okay. Okay, let's get started. What is missing in the first sentence? Let's listen to Aramchalam. What do you
Yes, ma'am.
think?
Ma'am, I have got some good news for you. You have made a good recovery or a good thing, ma'am, and we are going to discharge you.
Yes, okay, so it looks like
Yes, ma'am.
it is okay. So then,
Yes,
Madhumita, please.
First, I would just like to have a brief chat with you about your medications or something like that.
Yes, good. Well, the next is for Divya.
Yes, ma'am. If at any time you want to stop me and ask questions, dash, there's a lot of information to take in at one time.
So, any ideas about what is missing here?
No, ma'am.
No. Who can help us? What do you think?
Ma'am,
Can
can
I?
I?
Yes, please.
We are going to, sorry, if at any time you want to stop me and ask question, please don't hesitate.
Yes, exactly. Okay. So the next is for Priya.
Yes, ma'am. We are going to give you a small dose of 75 mg. It's a much smaller dose than you had normally buy over the counter. You can take it from the pharmacy.
Okay, possible. Then Rerna, number 5.
Yes, ma'am. The aspirin will help you a lot, as aspirin helps in the thinning of blood, and so it can prevent your further heart attacks.
I see. Okay. Well, Nishat.
Yes, ma'am. And I emphasized about possible, but I just have to point them out so that you are aware of them and can do something about it if anything happens. And I emphasized about possible, and we can say about that.
So what does it mean if he says it's possible? So
it reduces the heart attack, clots, blood clots.
Okay.
Ma'am, he might be saying that it is possible to get another attack because some people might get.
I see. Okay.
Yes.
And
Prepare for
so the next one is for Prakriti. Is Prakriti? Yes, number 7.
Sometimes people get, yes, ma'am. Sometimes people get this or aspirin can make this or it can cause.
So this is about complications, yes? Side
Yes,
effects
ma'am.
of aspirin. Or which side effects of aspirin do you know? Is everything okay with aspirin? Or are there any
No, ma'am.
complications? So who can help
Ma'am,
us?
there are some complications like
Ma'am,
drowsiness and
yes.
headache.
Nausea.
Sometimes bleeding, right?
Yes,
Bleeding,
ma'am,
ma'am, bleeding,
rashes, cramps,
and
And
ma'am,
excess stomach acid secretion.
breathing problem.
and even
Yes.
sometimes in
Okay.
ulcers, ma'am.
Okay, now,
Gastrointestinal ulcers.
yes, thank you. Now it's time to listen to the doctor, what the doctor just tells himself, and just compare with what we've already written here. Now,
Listening to.
Good afternoon, Mr. Johnson. My name is Dr. Howard. How are you today?
I'm fine, Doctor.
That's good. Well, I've got some good news for you. You've made very good progress and we're going to let you go home.
Really?
Yes. But before you go, there's just one or two things to do. I can see you're very pleased about going home.
Well, I am.
Well, we won't keep you long then. First, I'd just like to have a brief chat with you about your medication.
Okay.
We're going to give you lots of tablets to take with you and make you rattle a bit.
Okay. I thought that might happen.
Right. Now, if at any time you want to stop me and ask questions, feel free to do so. There's a lot of information to take in at one time.
Yeah, fine.
The first tablet, which I'm sure you're familiar with, is this little white one, aspirin.
Yeah.
We're going to give you a very small dose of 75 milligrams. It's a much smaller dose than you'd normally buy over the counter. You take it by mouth once a day after a meal from now on.
Okay. Why do I need to take it?
The aspirin will help you a lot as it thins the blood and so helps to prevent further attacks.
Okay, that's good.
Now, as with everything we take, there are some possible side effects.
Mm-hmm.
And I emphasize the word possible, as you may not get any of them. But I just have to point them out so that you're aware of them and can do something about it if anything happens.
Okay.
Sometimes people get an upset stomach, or aspirin can make the stools of some people dark and smelly, or it can cause bleeding, like nosebleeds, or shortness of breath. But remember, I'm just pointing them out to you so that you're aware of them. Also, look at the leaflet that comes with the tablets. If you do get anything, just get in touch with your GP. Is everything okay so far?
Yeah.
Okay. Would you like to go through everything and explain it to me?
Okay, so we have only 2 minutes left. So what is missing in the first sentence? You've made Samhita.
A very good progress, ma'am.
Good progress.
And we are going to
Let you go
let
home.
you go home. In the
Let you
second
go home.
sentence, a brief chat with you about
About medication.
About
your
your
medication. Yes. Number 3, if you want to stop and ask questions,
Feel free to
Feel
ask.
free to do
feel
so.
free to do this. Okay. Number
Yes, ma'am.
4, you take it
By mouth
once a day after meal.
Mouth
once a day after
Yes.
meal.
After meal.
Now on.
Yes. Number 5, the aspirin will help you a lot as
It thins
The
blood
blood
and
and
helps
provide
sick, ma'am,
prevent the
analgesic,
further
decrease
attacks.
the pain,
yes, prevents
Prevent
the
further heart attacks.
Further attacks.
In number 6, I emphasize the word possible.
You may not get
As
you may get any of
any at all.
any of
Yes,
them.
may not get any of them.
Any of them.
And sometimes people get
Upset
Upset
stomachs,
upset
dark,
upset
smelly,
can make
dark, smelly,
or nose
Stool,
bleeding.
dark and smelly, and bleeding
cause
like
Nose
bleeding.
shortness of
cause
can cause
can cause nose
bleeding. Yes.
or it can
Okay.
cause
Cause
shortness
nose
of the
shortness.
breath, can
Yes.
cause the shortness of the breath.
Yes, shortness of the breath. Thank you. Now we'll meet in 10 minutes just to listen to your presentations. Okay.
Okay, ma'am.